Hi, my name is Dr. Renn, and I am reviewing cervical spine disc injury home care instructions. These are the instructions that we give every disc patient that comes into our office that's been diagnosed with a disc injury. Some basic guidance on what to do while they're at home and away from us. The first thing we tell patients is to do some chin tucks. Do a minimum of 3 times per day or once every hour and hold for about 10 seconds each. The idea of this is to get a relief of pain, and also if pain is going into the shoulder blade or scapular area or down the arm, or if there's any numbness and tingling, then that should be reduced as well. It's trying to give some sort of relief to the patient. If you're not feeling relief doing these at all, then your case might be just a little bit more complicated, needs a different assessment. We find this works for most patients, but however, if it's not giving you any relief, then there could be a technique change that you'll do, or a different set of protocols that we would follow and give you if we evaluated you in the office. One thing that everyone can do is just rest. If you're having a disc injury, it's good to have just once an hour, is give your head a break, sit back and relax against a chair or wall or something, just to kind of give it a few minutes break while you're up. Laying down isn't a problem if you can do that throughout the day. And just in a reclined position, we find a lot of patients they do better in. The cervical collar. Sometimes we recommend the cervical collar for patients just because they take the bus, they drive a lot. We don't want them to get another accident, or the jerking motions of those types of transportation. They will kind of aggravate things, so it can give you a little extra support. Some patients will even like sleeping with them, just so their head's not falling to the side or getting in an awkward position. They tend to wake up a little bit better in the morning. Now, most times we don't recommend immobilizing any joints once they've been injured, because it doesn't help to get the patient better faster. However, in the situation where there is a lot of pain, a lot of discomfort, and there's certain activities that are doing it, then we feel like wearing a cervical collar can sometimes be helpful. So it's not for everybody, but in certain situations we find that can be. And you can usually pick these up at your local Walgreens or CVS pharmacy. Ice. In order to help control some of the pain, we recommend ice. In the first couple days, week or so, we recommend just doing that once an hour, and you can do that for about up to 7 days. Patients will naturally stop doing this, and they'll do less ice as the pain kind of subsides a little bit, and they don't need that break during the day. And just to put it over the areas in which the patient's feeling pain, a lot of time it's in the neck, or it could be in the shoulder and scapular blade area. And then how long should we use ice for? Well, it could be between 5 and 15 minutes. It just depends on the strength of the ice. If you're using ice cubes versus frozen peas, it can be very different for different sources of ice. But following the acronym CBAND, which is cool, burn, aching, numb. When it gets numb, you want to remove it. Otherwise, you can get some frostbite. Stretches and exercises, a big none. We always give patients exactly what they need to do, all the physical therapy exercises they need to do, and we just ask them to stick with that in the first couple of weeks. Once we do a progress exam in a few weeks, usually every 6 visits or 2 weeks, then we will let them know what more they can add back into their program. But just giving the neck a rest, keeping it from doing extended ranges of motion and looking all the way up to the ceiling or all the way down at the floor, or avoiding those long static postures usually tend to help. A couple things that really help is sleeping positions. What patients have reported to me over the years is that sleeping in a reclined position really helps. I've had patients who have lazy boys. They'll sleep in there. They find that they can get the best rest. When they're laying flat, like they usually do on their backs, they tend to get a little bit more pain. So if they had a wedge pillow, they could use that when they're laying in bed. Again, sitting in more of an upright position, usually it is, and then if it feels necessary, you could wear that cervical collar to kind of keep that neck immobilized so it's not getting into those positions. Proper sitting, this is a really big one. Basically, when you're standing up and you want to see a good lumbar curvature in the spine, we want people to sit down and maintain that exactly. And the reason is because it'll force you to sit up really straight. And as soon as you do, you start reducing that curvature, slouching, you kind of get into this position, putting more pressure on the nerves in the neck, causing more pain and discomfort. So sitting upright is a really important thing. And when you stand, you actually do that. That's why standing is more recommended for desks these days, doing office work, because it gives you into more natural posture. Now, we'll get into a different video that has some more recommendations on that, on specifically what to do and how to stand longer. But basically, sit for no longer than 30 minutes, stand as long as you're comfortable, and kind of repeat that formula all day long. And you'll find you'll be able to stand longer and longer. Some supplements that we recommend taking. We got all these products here. These 3 are from Metagenics. They've just proven over the years that they work really well. The first one is just mild calm. I call this our natural muscle relaxant. It won't aggravate the stomach. And you can take 3 tablets 3 times a day, AM, noon, PM, and bedtime. And then Mild Calm Plus just has a couple extra herbs, pretty much the same formula of this, but we take 6 tablets before bed to help kick in that sleep cycle if the patient's having trouble sleeping. And Flavonoid Intensive Care is another great one. This is a turmeric heavy product, and it can be that natural anti-inflammatory to help decrease some of that swelling and inflammation in and around the nerve roots. The only other recommendation of over-the-counter pain medication is, we recommend taking, Advil, Motrin, things like that nature. If they've checked with their pharmacist to make sure there's no other cold medications or other products they're taking that would mean that they shouldn't take it, or they're overtaking it because of other medication they're taking in their life. But taking it when you're miserable throughout the day, we tend to say to patients, avoid taking it if you can. That way you don't have to feel the pain. If you're feeling the pain, it'll help guide you in what you should be doing. And again, if you're ever getting more pain in and around the neck and it's going down the arm or into the shoulder blade more, try and find a position that does that. We don't want the pain to go down. We want it to kind of get back up and centralized in just the neck. And anything you're doing to aggravate that, you're just kind of making things a little bit worse. So try and avoid those. Hopefully you find this helpful, and have a great day.